Hi, I'm Dr. Tania Bishop, Wyre's wildlife veterinarian, and today I'm going to talk to you about the importance of gut flora to koala population health, especially in the face of climate change over more recent years. Koalas are adapted to a diet of eucalypts, which are generally considered to be a nutrient poor and toxic source of food that are low in available proteins and available carbohydrates while having high concentrations of phenolic compounds. To overcome this, koalas have evolved a range of anatomical and physiological adaptations to assist with digestion and absorption of nutrients from this food source. Koalas are largely reliant on microbial digestion in a uniquely adapted hindgut, the cecum. So, as we can see from this picture from the Australian Registry of Wildlife Health, the koala dissected here, the cecum takes up almost the entirety of the abdominal cavity of the koala. So, in the side-on view, you can see just the size of the cecum here, which can be up to 2 meters in length in an adult animal. And again here in this picture. So in 2022, the koala with the combined populations of Queensland, New South Wales and the ACT was listed as endangered on the 12th of February. A combination of ongoing habitat destruction and degradation over the last 20 years, followed by prolonged drought, climate change, and then the catastrophic fires of the Black Summer were all thought to contribute to the reduction of the koala population from 33 to 61% since 2001 in New South Wales alone. Poor and reduced habitat forces animals into less favourable habitat. They're under increased nutritional stress. So this places even more emphasis on the need for this highly specialised microbial fermentation because they were already existing on a very poor, nutrient-poor diet. So moving into poorer habitat with trees that are under increased nutritional stress means that koalas are under even more nutritional stress and more factors which I will talk about soon, which can affect koala health quite significantly. As an addition to this, it also means that they need to move more with territory crossover in order to gain adequate food, for young to disperse and for mating behaviour to occur. So this also forces animals into increased risk of motor vehicle accidents, domestic animal attack, but also disease. Extinction of the koala was predicted by 2050 by the Koala Disease Risk Analysis if urgent action wasn't taken. So when we have a look at why koalas present into vet hospitals on percentage of intake, we can see that there's a certain percentage here that are trauma, but around about more than 40% of cases here are presenting as diseases. So this could be anything from chlamydia, corv, but also oxalate nephrosis is becoming an increasingly more prevalent condition. So it might be something that's presented with another disease, for example, chlamydia, or we may just be seeing koalas in especially fire-affected animals that people are reporting as coming down with renal failure related diseases. So this requires ultrasound examination in order to identify this, but also joining that with the fact that these animals are dehydrated. So obviously we know that when we see a koala drinking, we know that they're in real trouble. So oxalate nephrosis is something that has become increasingly more prevalent over time, especially as climate change has taken its toll on koalas. And we'll explain later in this presentation how that happens and why that's so important. Between 5 to 7 months of age, a wild koala joey will initiate what's termed pap feeding. So they start to nuzzle the mum's cloaca. In the same age joeys, they'll often do this to their carers as well. But this triggers the mum to sort of go into like a gut spasm, and it triggers her to pass a specialised form of soft runny feces, which are formed by faster contractions directly from the mum's cecum to the colon. So what that means is that all of the bacteria that would be presented in the cecum come out as what we call pap. and they make it to the cloaca safely, because what we know is not every bacteria that a koala requires to seed that cecum makes the natural trip from the cecum through to the through the colon, through the cloaca. So this is an absolutely vital stage in joey development. The joey will ingest this until basically as it's needed until its cecum successfully seeded with enough flora to sustain their own population of bacteria in their ceca. And it allows them to then start digesting leaf. The biome of the joey gradually changes from the first intake of pap through to independence at around about 1 kilo. The collective bacteria in a healthy koala cecum is called a biome. So it exists in a delicate balance, with each bacterium carrying out an important part of the fermentation and digestion process. And each bacterium is usually dependent on a byproduct and conditions created by other bacterium in order to survive. So what can happen is, under conditions where one bacteria might be killed off, or there might be an overgrowth of another bacteria, this causes an imbalance, which we call dysbiosis, and can allow overgrowth of some bacteria and potentially the entry of pathogenic bacteria, which can have very serious consequences, from typhlochlitis right up to septicemia. So what we're seeing in this diagram are the biomes of 2 koalas, with a good abundance and a good mix of different bacteria that have seeded the gut. Koalas have got very specialised bacterium, and one example of this is Oxalobacter species. And Oxalobacter species are responsible for the natural breaking down of oxalates that are found naturally in all eucalypt leaves, but they're found in increasing amounts in certain species over others, but also in the leaves of trees that have been put under incredible stress. So fires, droughts, porous soils, floods, and things like that. So as we're seeing, this is becoming more of a problem as habitat destruction progresses and climate change continues. The other thing that we can see from this diagram here is that there are different kinds of bacteria that are more present in the cecum versus the colon versus the fecal pellet. So that we can see that in emergency situations where we can't get pap, or situations where that just isn't possible, whilst giving fecal pellets to koalas as an alternative in order to ward off dysbiosis and potentially septicemia is what you would do, it's always ideal to seed the koala's bacteria with cecum or pap, which can be collected from a dead, healthy koala, in order to seed a cecum, because the actual composition of bacteria that's in the cecum is quite different to what comes out in the fecal pellet. Excess oxalate intake leads to oxalate nephrosis in koalas, which eventually causes kidney failure as the crystals build up in the kidneys. Concurrent illnesses such as chlamydial treatment causes a koala to crash earlier from oxalate nephrosis, and this is often due to a mixture of stress of being brought into captivity, stress from being diseased, but also from having to be on a long-term antibiotic treatment. We're also seeing a lot more of this condition though in animals that are coming from fire-affected areas, or areas where there's been a lot of urban development and koalas have been moved into very porous soil conditions where the trees are under excessive stress, or where there's been floods or a lot of fire through. Lack or loss of this bacterium from the biome will cause a koala to be more susceptible to oxalate nephrosis, amongst many other serious consequences. So what we're seeing here is an ultrasound of a koala that has high oxalate crystals. So this outline that we're seeing here is the outline of a normal kidney. And this is the normal kidney pelvis. But all of these very white specks that we're seeing here are all crystals. So normally the koala kidney should just have a slightly whiter center part or medulla, and the cortex should be darker than this, but you can see in this case it's full of oxalate crystals. Koalas have got an extremely sensitive but specialised gut flora required in order to be able to digest the feed that they've evolved to consume. So, an imbalance of the flora can contribute to oxalate nephrosis. It can result in dysbiosis, or that imbalance of bacteria, because they all rely on different byproducts of each other, and even typhlocollitis, septicemia, and even death. PAP, or the contents of the cecum, are used to replace this normal flora if needed, or to initially seed the gut as a joey. So, if orphaned, it will need to be given by a carer at the right stage. And koala joeys will generally tell the carer when this stage is reached. Most carers will report that the joey starts to nuzzle their hand around feeding time and things like that. So stress, incorrect feeding regimes, antibiotics, incorrect diet can all affect gut flora and trigger dysbiosis and worse in both adult and joey koalas. And PAP can help correct this in adult and joeys. Now, as I mentioned before, in situations where PAP is not possible to get, fecal pellets can be used, but it must be noted that not all of the essential bacteria will be there. So these koalas still have to be monitored very closely for things like oxalate nephrosis and dysbiosis to make sure that we have actually managed to reverse the problem. Joeys and older koalas that are compromised with dysbiosis, established candida, so candida or yeast will often come along when we've got that imbalance because the conditions in the cecum that would normally suppress candida growth aren't there. Or dysbiosis may show very little to no signs. So sometimes all you see with a koala with candida and dysbiosis are maybe slightly misshapen feces. You might see a little bit of leaf drop on the ground. You might see them starting to eat a little bit of stalk. But in most cases, you may see nothing. In older joeys or koalas, out of the normal time frame of around 6 months, to 300 to 600 grams, need PAP. You should always contact your coordinator to determine if an underlying cause also needs to be diagnosed and dealt with. It's not unusual for koala joeys in the 600 to 1 kilo range to need PAP due to dysbiosis from the stress of orphaning alone. So as we can see here from this picture, this is normal gut flora. So there's a good variation. There's no overgrowth of any one particular type of bacteria. So in this case, we can see that there's moderate dysbiosis here. So we've got a bit of overgrowth. We've got some of too many of the same bacteria growing here. This koala's been eating a fair bit of medicinal leaf, and there's less variation in the bacteria that are here. In this case, we can see that we've got dysbiosis. So there's very little variation in the type of bacteria here. So what we're talking about are, normally we've got rods and cocci and even koala yeasts, which are more cigar-shaped in normal koalas. But in this case here, we can see what we've got is budding yeast, which are candida. So they're normally circular, and the top of the bud is smaller. So I normally liken them to snowmen because you've got quite a circular base with a little bud on top. And seeing this with little variation is always a sign that action needs to be taken immediately. Reseeding the gut flora via PAP from a healthy koala eating from a varied number of tree species can increase the number of species a koala can eat, as it increases the koala's ability to digest and therefore obtain nutrition from a wider range of species. So it's always mentioned that it's ideal to collect PAP from koalas that are from the same area so that they can digest the same species of tree. But there's a fundamental group of bacteria that make up the core of the biome of the koala, which are needed, which means that when we're talking about emergency situations, so when we need to seed a joey PAP and we don't have a mother present, or we've got dysbiosis occurring or candidiasis that we need to correct, we know that we can collect PAP and give PAP to koalas from a much wider range of areas. So in the Southeast Queensland Koala Hospital unit, PAP tends to be shared amongst all of the hospitals because it's not always readily available, so that we know that we can collect it from a fairly wide variety of areas. However, it is ideal for koalas to eventually get bacteria that are from the area that they'll come from, so that they've got those additional bacteria in order to have the specialized bacteria for the species that they'll be exposed to in the wild. So when caring for joeys, fecal checks are usually at least a once a month or twice monthly occurrence after and during the papping phase, to ensure that the cecum's becoming seeded with the correct bacterium needed, and also that candidiasis or dysbiosis, which is your imbalance or overgrowth of certain bacteria, is not occurring, or worse, you've got typhlocollitis starting. And typhlocollitis is inflammation of the cecum. So what that means is you've had conditions in the cecum that have allowed introduction of a pathogenic bacterium, which can rapidly establish and cause inflammation of the cecum and colon, and can eventually lead to septicemia and death, often very rapidly. On ultrasound, when we have a look at these koalas, they'll have a thickened cecum with a thickened wall, and sometimes we see what we call cartwheeling of that cecum, which means that we're having cecal contractions because it's inflamed. So you'll see it whipping around on ultrasound with that thickened wall. But as far as external signs go, we'll see that they're going for more medicinal leaf, as you can see here in this Melaleuca species. In this case, we've got budding yeast, and this is a very severe case of candidiasis. As you can see, there's a lot of budding yeast here. And this is a case where we've got dysbiosis, but we've also got quite a few budding yeast here. So these are all big warning signs. So externally with these koalas, what we might see is that they're eating, you might see leaf drop, so a koala biting off leaves, and rather than chewing them, they're dropping them on the ground. So it's important when we're looking at a koala that might have an issue with dysbiosis that we do both a mouth swab but also do a fecal check, because we want to just make sure that we don't have an issue within the mouth with candidiasis, but also within the feces. So this leaf drop can be a koala biting off leaves, and instead of chewing them, they're dropping them on the ground. You can also see a drop in the number, or you can see a change in the shape of pellets. They'll also eat down to the stems, and they'll be seeking out more medicinal species. Now, this can be a completely normal behavior, but you'll see them eating a lot more. So also eating a lot more diatomaceous earth or termite dirt can all be a sign that must be caught early, that dysbiosis or possible candidiasis should be an issue. But prevention is always better than cure. So getting if in doubt, getting a check done and getting it stained with Diff Quick is an absolutely essential thing to do. Dysbiosis is recognised an imbalance of the gastrointestinal bacterium or an overgrowth of a particular bacterium. So it's not the normal population. Once budding candida is recognised on a fecal Diff Quick stain, it's important that treatment is commenced immediately, usually with a systemic antifungal agent, and continued until you get 2 negative fecal stains. So that means no budding candida seen on a stain slide. So we tend to use a local antifungal if we think that it's just oral only, so like nystatin. However, it's been found that contact agents like nystatin are fairly ineffective at treating established candidiasis in the cecum, because it's just like a drop in the ocean when you think of the size of the cecum. So we tend to use a systemic antifungal, such as amphotericin B or diflucan. Typhlocollitis is accompanied usually by diarrhea. So by the time you see cow patty type feces, or the koala is hunched or tooth grinding or anything like that, this is an emergency. You must get that koala to a vet as soon as it's possible. So PAP should ideally be taken from healthy donors without rupture of the gastrointestinal tract. So we quite often will take PAP most commonly from healthy koalas that were hit by car, but the cecum must also always be checked to make sure that there hasn't been significant bruising compromising it, there hasn't been a tear, and the animal's also not diseased. Pap can be added to the formula for milk fed to joeys, but pap can also have a few drops of pre-boiled and cooled water to warm it before feeding to older joeys already on leaf or adults requiring pap. Some koalas will take pap purely on its own. Some will take it mixed with criticare and paste. They do tend to seem to take pap until they no longer need it. So there's no general formula as to how long to give it. So as a general rule, if we've got a koala on pap, we tend to go up to what we call a quarter of a pot. So when we're talking about a pot, we're usually meaning like a urine sample jar for pathology is usually what we use. But as you'll see, if you try to feed a koala pap, they'll take what they want and then they won't take any more. And sometimes it requires a few different methods in order to get some koalas to take it. Some just reach out for it, like they just love it, whereas others it can take them a little bit of time to come across. Pap can be offered off a teaspoon or a 3 ml syringe with the entire top cut off. Joeys will vary in how much and for how long they'll take pap. Some will only take pap 1 to 2 times a day for a few days, and others continue for several days. It really just depends on how long it takes for them to reseed that cecum. Carers notice, like I've mentioned before, that when joeys require pap, they often nuzzle their carers' hands in a similar fashion, and they also may refuse milk feeds until they get pap. Pap should be continued to offer once a day for at least a week after the pap was refused, just in case. Most joeys will seek pap again, usually about 2 weeks later. There's a high likelihood that joeys don't survive without getting pap initially, because this seeding is required for them to do the proper changeover to being able to digest that diet of eucalypt leaves. The pap feeding stage is noticed as being the most difficult stage in the hand raising process, where higher mortalities occur due to digestive problems such as dysbiosis, candidiasis, gut stasis, typhlochleitis, and septicemia. So once pap feeding was added as a routine in koala hand raising, there was a significant drop in fertility at this age noted. So it makes it quite an important thing to try and do. Correct pap feeding and timing also helps reduce these issues. So one of the signs can be a stool and weight gain around about this time, or growth, and sometimes you get an apparent failure to thrive as the first sign that there's an issue with the gut biota. So as we can see here from this diagram, as the papping process starts and then continues, the feces of the joey show a predictable pattern of change as the gut biota establishes and then matures right up to weaning. So we get sort of this pasty sort of food while they're on pure milk. Then it starts to change over. Then you start to get a little bit of solidification. And as you move along through the pap feeding stage and out through to pouch emergence, you see that they start to produce those characteristic pellets of koalas. And we know that we've had good establishment of gut biota. So according to Blyton et al., the higher microbial density, evenness and composition of pap likely makes it superior to feces as a source of microbes for inoculating joey koalas. Pap feeding by joeys appears to seed their gastrointestinal tracts with maternal microbes, and their gut biomes then change in response to an increased proportion of leaves in their diet, reaching an adult composition by independence. And this is just a comparison of the bacteria that are found in pap compared to feces, and as we move from joey independence compared to pap feeding. So pap is produced, as we mentioned before, by the rapid peristaltic movements of the cecum and colon, producing pap, which is almost purely cecal contents. The usual slow transit time from the cecum to the cloaca means that pellets will contain some beneficial bacterium, but will not be sufficient to reseed a cecum completely, with moderate to severe dysbiosis or bacterial depopulation. But it's worth mentioning that definitely in cases where In cases where PAP is just not available, or we can't get a hold of PAP due to remote conditions, etc., feces are definitely better than not doing anything at all. As you can see from the diagram shown above here, fecal pellets, like I mentioned, are of a benefit, but many essential bacterium don't survive the passage to the cloaca as pellets. Essential bacterium are also present in far higher numbers in cecal content, so therefore pellets can be useful, like I mentioned, in an emergency, but won't serve the same function as PAP for reseeding completely. So it's really important for groups to try and see if PAP collection and storage can become part of a normal routine, especially within groups that regularly care for koalas. So collecting and storing PAP and knowing where that is to distribute it to members is really important. So know what normal PAP looks and smells like. So PAP actually should not smell, it shouldn't smell offensive. It should smell like eucalypt mixture. So it's one of those things that the more you smell, the more you know that it's correct PAP and it's healthy PAP. So if in doubt, discard it, especially if it's got quite an offensive smell to it. Koalas hit by cars, like I mentioned, are often useful if the cecum's intact. PAP should be taken as soon as possible, within 3 hours if cool or refrigerated, or within 1 hour in hotter conditions. PAP can be collected with chlamydial koalas if the demand is very high, but use only in emergencies. So in hospitals where I've come from, we've marked PAP, clean PAP, meaning non-chlamydial PAP, and dirty PAP, meaning from koalas that have got chlamydia. So obviously up in Queensland, we count chlamydia as being endemic everywhere. But down further south, in areas where this isn't the case, you would certainly only ever feed PAP in an emergency situation from a chlamydial koala in an area where there is already chlamydia present. We haven't found a huge amount of transfer of chlamydia over to koalas that have used dirty PAP. However, we only ever use it in severe emergencies. We never collect PAP from koalas with retrovirus or AIDS, dog attack koalas with a ruptured cecum, or very severe cystitis chlamydia koalas, or koalas with very poor body condition. It's usually a 2-person job, so one to label and hold containers and another to collect. So the equipment that you need are surgical scissors, a garbage bag, a scalpel and a handle, gloves and paper towels, multiple 70ml sterile containers, so usually those yellow top pathology containers, a permanent marking pen, a face mask, and a bottle of water for irrigation, and a paper towel if there's some blood in the abdomen. So note, if the vet has used intraperitoneal lethabarb, the animal may no longer be a candidate for PAP donation due to potential contamination with lethabarb. So you need to ensure this, as intoxication could occur. IV lethabarb or definite intracardiac lethabarb is completely safe. So place the donor animal on its back in a garbage bag. Wear a face mask and gloves every single time. Open the abdomen with the scalpel as close to the center as possible. Be careful not to push too hard and nick the cecum or stomach. Locate the end of the cecum and cut off the end with the scissors. Check if the cecum's not covered in blood. If so, just gently wipe the outside of the cecum with a clean paper towel. So this is what you want to see. If the cecum looks very bruised or compromised, meaning there's a lot of red all over it or there are very dark patches, etc., don't use that PAP. Hold the cecum, so you want to pull out the whole length of the cecum in this case, and you want to hold the length of the cecum with one hand, and you want to squeeze out the contents of that cecum like you would if it was an icing bag. And you want to start to direct that contents into your containers. So once you've done this, you want to place lids on the containers and label them with the date and whether it was clean or dirty, and the expiry date, which will always be 30 days after the collection date, and it must be kept refrigerated. Thank you for listening.